Hello and welcome to today's program, doctors. Today what I want to talk about is the ICA best practice x-ray guidelines. And the reason why I want to talk about these guidelines is because they are the best x-ray guidelines in the market today for both injury assessments and for assessing the actual underlying cause of chronic pain in the spine. Remember, the lumbar spine is number one. It's the injuries to the lumbar spine are the number one physical cause of pain and disability in the world today. Injuries to the cervical spine are number 4, and injuries to the cervical spine that cause headaches are number 6. So when we know, one of the things we know in the market today is we have a lack of ability for doctors to locate the actual cause of chronic pain in the neck and in the back, which causes the leading causes of low back pain, neck pain, and headaches. The ICA best practice x-ray guidelines actually obliterate that. If you follow the guidelines, they tell you exactly what to do and what you're supposed to do. Now, the biggest problem in my profession of chiropractic is that most doctors of chiropractic do not follow these guidelines. They're brilliant guidelines, but they're not followed. So in today's program, what I want to talk about is smart injury doctors follow these guidelines to a T because they're key to injury assessments and to chronic pain assessments. So let's talk about what they are. First of all, they were designed for the profession of chiropractic in the assessment of certain things. So there was 5 things that a doctor of chiropractic was supposed to be doing with his x-rays, his or her x-rays. Number 1, a subluxation assessment. Now, anybody in the chiropractic profession knows that the chiropractic profession has gone mad on this term subluxation. And in my experience, it's gone mad because it doesn't understand the definition of what it actually is. Thinks it's non-scientific, thinks it's philosophical in basis. Nothing could be further from the truth. A chiropractic spinal subluxation is identical to a spinal instability, which is a medical term. But let me explain what these guidelines say. They say step number 1, you're supposed to do a subluxation assessment. So what's a subluxation? Well, it's a chiropractic subluxation, not a medical subluxation. A chiropractic subluxation means that you have a malaligned or malmoving vertebra that causes nerve interference. Now, where the chiropractic profession got a little off the mark on this particular term is there's also a medical term called a spinal subluxation, which means less than a full dislocation of the spine. That is a complete clinical entity, or a complete imaging entity. You look at that on imaging. But that is not a chiropractic subluxation. A chiropractic subluxation is you have to have malposition or malalignment, malmovement alignment, that causes nerve interference. Now, once you remove the nerve interference, you remove the chiropractic subluxation. And what's left is you may still have malposition or malmovement, but it no longer is causing nerve interference. So a lot of doctors of chiropractic thought that in order to remove a subluxation, you had to change the x-ray, which the majority of chiropractors are not doing. Now, there's a low number of percentage chiropractors that are focusing on realigning the spine. That's different. That's a smaller percentage of practitioners, and I subscribe to that. I think that's the best way to manage the health of the spine. But we're looking at x-ray guidelines on today's program, and we're just talking about you need to do a spinal subluxation assessment. So what that means is that you take x-rays, you have malposition or malalignment, and now you do a motor check at each level. Today, most doctors don't even know how to do that anymore. It used to be a standard procedure, and what's unfortunate is in most chiropractic colleges, most chiropractic students today do not know how to do an assessment for spinal injuries. Simple assessments for spinal ligament injuries are not being taught in chiropractic today, and it's very unfortunate. So you have malposition or malmisalignment in motion. You do a motor check to see if you've got any weaknesses. You do a sensory check to see if you've got any alteration in sensation. Or you do a pain correlation to that level. If you have any of those 3, and you have the malmovement or the malposition, you have an active spinal subluxation. You remove the clinical entity, you remove the chiropractic subluxation. It's just as easy as that. The ICA best practices guideline says that you're looking for malposition and malmovement patterns. That's what a good doctor, a good spinal doctor does. Number 2, it says determine the spinal health by determining the presence of any soft tissue damage or fractures or bony pathologies. So soft tissue damage. Ligaments. Ligaments are designed to hold the spine in alignment through all of its intricate movement patterns without allowing any slippages, so that there's no interference with the nerve or the neurology that's associated with the spine. Very, very simple concept. So when we have ligament damage, we know it causes excessive motion. And the amount of excessive motion in the spine, so simple stress radiology can show if a spine misaligns under stress, and that's called malmotion. It's most clearly determined on X-ray. Just like these guidelines say, not necessarily DMX at this point. We're talking, these are X-ray guidelines. These are plain film, digital X-ray guidelines. So we need to determine the severity of ligament damage. Well, how's that done? Well, you accurately measure the intersegmental motion. So what a doctor wants to do is take these types of x-rays, whether they take them or they send out to an imaging center to take them, then send them out to board-certified medical radiologists to get excessive motion testing done. It's very easy to determine the severity and location of ligament injuries using that procedure. Very, very easy. That's what smart injury doctors do every day in their practices. Number 3, you're supposed to make an assessment of any spinal instability. So what's a spinal instability? That's the medical definition of a chiropractic subluxation. It means malmotion or malposition that causes a motor, sensory, or a pain problem associated with it. So it's the same thing. It's a clinical entity, not just an imaging entity. You have to have both clinical findings and the findings that reflect back to the image. So as soon as you remove the motor, sensory, or pain problem, you've removed the spinal instability. So first 3 steps: subluxation assessment, spinal health assessment, including any assessment for spinal ligament damage, any soft tissue injury damage, any bony pathologies or fractures. You do a spinal instability assessment. Next, you assess for any bony pathology or any degenerative changes in the disc. That's step number 4. Step number 5 is you make an accurate count of the vertebra. And what is this done for? The ICA best practices says it's done so the doctor can determine the best, most appropriate treatment plan for the patient for that condition. These guidelines, as I've said earlier, are the top guidelines in the world for spinal injury assessment with X-ray, and also for chronic pain assessment, the cause of chronic pain assessment in X-ray. These are by far the top guidelines. And it's unfortunate today that so few chiropractors and so few medical providers and so few osteopaths know of these and are using them, because if they were used, they significantly reduce down the costs in the market. They significantly improve the treatment results in the market, because early diagnosis is the key to betterment of conditions. And again, costs would be significantly reduced. So in the Smart Injury Doctors program, our doctors are trained to be the top in their profession for spinal instability exams. And again, it's unfortunate that in my profession, in the chiropractic profession, no doctor of chiropractic college, no college today is teaching doctors great injury evaluation procedures. Injuries are the #1 cause of chronic pain and suffering in the country today, and our colleges and our providers need to understand how to do these simple procedures. And that's what I wanted to talk about today, doctors. If you are interested, you can go out to the ICA Best Practice X-ray Guidelines and pull this document and take a look for yourself. What I'm going to tell you is start applying it. You're going to have a lot better and happier patients once you do. So thank you very much for your attention on this program today, and I look forward to you on the next program. Thank you.